What are the 5 stages of dying? Denial, anger, bargaining, depression, acceptance. In a cardiac arrest, what is the usual dose of epinephrine? 1 milligram IV push every 3 to 5 minutes. The order is to give a combination regular and NPH insulin. How do we draw the mixture? Draw the regular first, then the NPH. A patient is in the anuric phase of renal failure. How much urine output would we have? Less than 100 cc's in 24 hours. A client is in the oliguric phase of renal failure. How much urine output would we have? Less than 400 cc's in 24 hours. What is a pulse deficit? The difference between the apical and radial pulses taken at the same time. When should postural drainage be done? Before meals or 2 to 4 hours after meals. What is a positive Koenig sign? An attempt to flex the hip results in painful spasms of the hamstring muscle, usually in meningitis. Where is the most common location for a herniated disc? L4 to L5, L5 to S1. What is Valsalva's maneuver? Forced exhalation against a closed glottis. What are the early signs and symptoms of alcohol withdrawal? Anxiety, tremors, insomnia. What is the main reason for pain in angina? Ischemia of the myocardium. What position should the nurse place the client with the Sengstack and Blakemore tube? Semi-Fowlers. What is intermittent claudication? Pain in the leg during ambulation that is relieved with rest, usually a symptom of arterial insufficiency. What is the most common symptom of bladder cancer? Painless hematuria. What does a positive Trousseau sign suggest? Hypocalcemia. What does a positive Kvostek sign suggest? Hypocalcemia. What is the priority intervention in a burn patient? A patent airway. What is the best time to apply elastic stockings? Before the client gets up from bed. What is the treatment of choice for gonorrhea? Penicillin. What is intractable pain? Pain that can't be relieved by drugs. When is informed consent required? In any invasive procedure. How do miotic medications reduce intraocular pressure in clients with glaucoma? By constricting the pupil and increasing the outflow of aqueous humor. What would the widening pulse pressure suggest? Increased intracranial pressure. What is the purpose of the mist tent? To liquefy and loosen secretions. What is the classic symptom of pleuritis? Chest pain that increases with respiratory movement.